experts are saying South Africa should expect a fourth wave of coronavirus infections beginning in early December. It's as government announces that from tomorrow, people aged between the ages of 18 and 34 will be able to get vaccinated against COVID-19. For more on where we are as a country, we're joined by epidemiologist Professor Salim Abdool Karim. Professor Abdool Karim, at least in the image of the public, you've been somewhat in hibernation. Unfortunately, you come out of it with not good news. A new variant, a new wave, all of this as we're supposed to be celebrating the festive season. What can we expect?
Yes, a very good evening, Kathy, and good evening to all the viewers. I mean, right now, we are coming down in terms of the overall epidemic in the third wave, but that downward decrease has been stalled, and it looks like we're going to have a second small peak in our third wave, driven now principally by KwaZulu-Natal and the Eastern Cape. But we anticipate that numbers should go down within the next 2 to 3 weeks, and we'll then have, as we had in the past, we will expect to see that we will have a period of low transmission. In the first and second waves, between that period, it was about 94 days. Between the second and third waves, about 99 days. So we expect about between 94 and about 99 days. So let's say we have about a 99-day gap. So that means if we're going to have a fourth wave, it's going to take place in December, probably around early to mid-December. Now, we don't know if we're definitely going to have a fourth wave, but it's quite likely, and it all depends on whether we have a new variant. And we can reasonably expect that there will be a new variant in circulation by then, and that will drive our fourth wave. We don't know what that variant looks like because it hasn't emerged yet. But based on what we have seen in the trajectory, I think it's reasonable to expect that there will be a fourth wave and that it's likely to start in December.
Professor Abdool Karim, this reasonability in terms of expectations of a new variant, what is informing it? So what makes you believe that we could well be dealing with a new variant come the end of the year?
When you look at the rapidity with which new variants are being created, we have right now 4 variants of concern, and they have emerged since December last year. So the first variant that we learned about was the Alpha variant reported on the 14th of December. So from the 14th of December up to now, we've now had 4 variants of concern. So that's a period of around 8 months. So about, if you want to divide it, it's once every 2 or 3 months we can expect that there'll be a variant. It's not regular because it comes in batches. Now, if we look at transmission as it's occurring, we know that the people who are immunocompromised are those that are most likely to generate variants because they have persistent infection. And as new variants will be created, if they have an advantage, and the next variant may have, for example, the advantage of being able to escape some of our immunity, then it will be able to spread. So it's based on our understanding of the viral genetics, the kinetics by which the variants are created. Now, one must be very clear that it's not never ending. It's not that the virus can keep mutating forever, because there'll come a point where every time the virus mutates further, it loses advantages. And so that point, we're not sure when it's going to arrive, but we don't think it's here right now.
And you're bringing me to my next point. You know, when we talk about these impending waves and variants, so the new variant that you're projecting could well be in circulation in December. Can we anticipate that to be as harsh as the Delta or worse than the Delta? Are we able to make those projections at all?
So that's very difficult to make because there are different ways in which new variants may have advantages over the Delta variant. So when we had the Beta variant, that was a pretty bad variant. We didn't really anticipate that another variant will be able to knock it out and replace it. But Delta, because it spreads so much faster, was able to do that. Now, with the next variant, it might be able to spread even faster than Delta, but more likely it will have other advantages that give it an edge over the Delta variant. Well, what might those advantages be? Very hard to predict, unfortunately. But that's what we need to look at that, and there are people that are busy doing what we call stochastic analyses. They look at probabilities. If the virus mutates like this, this is what to expect. And so there's a whole series of potential mutations that have been mapped out. And it's too complicated to get into right now. Just be aware that we are looking at multiple possible scenarios for what the new mutations could look like.
So, Prof, what does this mean in terms of government policy and the responses that we've had as a country to COVID-19? I mean, does it mean that South Africans are going to be perpetually under lockdown until what happens? Until the majority of people have been vaccinated? What's the solution?
So I think I can summarize it as three key issues. The first is it's really important to vaccinate. And we've got to get high enough vaccine coverage. And particularly, we want to make sure that the elderly are vaccinated, especially those above age 60, because they have such a high likelihood of needing hospital care, and they have a very much higher chance of dying if they get COVID. And that must be a really important part of our overall strategy. But the more people we vaccinate across all ages above the age of 18, it's going to be important because that will slow the spread of the virus. So vaccinate, vaccinate, vaccinate. So that's number one. Number two is that even though we are vaccinating, and that even if we reach a high level of vaccine coverage, we still have to expect that we will see waves. How do we know that? Because the UK, which has a high vaccination coverage, has seen a third wave due to the Delta virus. Israel, which has even higher vaccine coverage, has a fourth wave with the Delta virus. So you will still see waves even if you have high vaccination coverage. And what's important is that you ensure that we can use our public health measures, our social distancing, our masks, and so on, so that we use it in combination with our vaccines. And then the third is that we can expect with higher vaccine coverage, particularly in the older age groups, that we will see very few deaths, that the number of deaths amongst vaccinated individuals is quite low. So even though they get infected, they get a breakthrough infection, they don't get serious disease in the same way as unvaccinated people. And that's one of the big advantages that vaccines bring in preparation for our upcoming fourth wave.
Prof, there have been different conversations had about the efficacy of vaccines, different types of vaccines to different variants of the virus. As this virus continues to mutate, what does that mean for the efficacy of vaccines going forward?
That's quite a complicated problem. Right now, the predominant vaccines that we are using, right, in this country, the Johnson & Johnson and the Pfizer vaccine, both those vaccines have been shown to be quite effective against all of the 4 variants of concern. So we don't really have a problem right now because the 2 vaccines we're using, they do quite well against all these variants. They do quite well even against the Delta variant. Now, they don't do as well against Delta as they do against Alpha. So we lose some amount of efficacy. With the Pfizer vaccine, it's not that much. For example, with the Pfizer vaccine, in some of the studies, the efficacy of the Pfizer vaccine for clinical illness goes down. In one study, it was at 88%. Another one, it was down to 64%. So somewhere between 64 and 88%. We think that somewhere there, which is lower than the 95% efficacy it had against the original virus. So the efficacy is coming down with the Delta, but its efficacy against severe disease and death remains intact. That still is hovering in excess of 95%.
Prof, you know, there were conversations around the possibility that by 2022, if we had vaccinated the majority of our population, we would well be, you know, out of the waters, that we would be able to return to a sense of normality, whatever this new normal or what life post-COVID is going to look like. It sounds more and more that this virus is going to be with us for a bit longer than has been anticipated. Talk to me about just your own observations and the kind of work that you've been doing and what you're gauging from the situation.
So let me start with an apology in that I've got a little bit more bad news for you.
No.
First is that...
No, I don't think I can take any more bad news from you tonight, Prof. I'm literally, I've been trying to keep it together, but I don't know.
So the first is that this virus infects animals. It infects dogs, cats, minks, tigers. It infects a whole lot of different animals, which means that even if we can control it in humans, it'll always be present in these animals, and it could quite easily come back into humans. In fact, minks have been shown to transmit it to the workers in the mink farms. So this virus is here to stay. It's not going anywhere. We are going to have to deal with this virus in the long term. Now, one of the challenges has been that when we first, heard about the efficacy of vaccines in November last year, we were very excited. We said, oh, here's a solution to this problem. We just need to vaccinate everybody. But then barely a month later in December, we hear about the variants. And then we said, oh my goodness, all this idea that we had, we could just vaccinate our way out of this problem. Well, that's no longer the case. In fact, I wrote an article about this in February this year, in which I said that the variants have changed the game. We can't simply vaccinate our way out of this epidemic. Now, vaccinations are important, but they are not by themselves going to enable us to keep this virus in check. And the reason is that as new variants come about, they may be able to escape some of the vaccine immunity, as we have seen with the Delta variant and the vaccines that we are using. Their efficacy has come down a bit. And so you get breakthrough infections. Now, there's no vaccine that's 100%. So every vaccine has breakthrough infections. We shouldn't get concerned about that. But the vaccines by themselves will not be good enough. We need to ensure we use combination prevention, that we use a combination of different things. For example, reducing the risk by keeping gatherings under control. But I think ultimately what we're going to see is a situation where we'll expect new variants, we'll continue to scale up vaccination, we'll introduce vaccine mandates for certain environments, because that'll be important. For example, in old age homes, we really have to have everybody vaccinated. That's not a choice, because the risk is so high in those settings. And then finally, we're going to have to maintain some of our public health measures, mask wearing being one of them. So I hope I've given you a sense about what the future looks like. We'll be able to ease many of the other restrictions, but we'll have to keep some of the personal protection with vaccines to maintain the virus at bay and to reduce the risk of new variants running rampant.
Professor Salim Abdool Karim, thank you so much. It's been a very sobering conversation. Yeah, certainly no good news coming up on the horizon as far as COVID-19 is